Hi, this is Dr. Raj Singh. Today I'm here to discuss about different questions related to testosterone therapy. So we have a hormone clinic in Las Vegas. A lot of questions related to testosterone. So first of all, what is testosterone? So in simple terms, it's a sex hormone. It's produced by the testes in men and the ovaries in women. In addition, it's also produced by the adrenal glands in both sexes. Testosterone is an androgen. It helps differentiate the sex characteristics, during embryology. So it kind of differentiates within what is masculine, what's feminine. It has a lot of other functions, but in the basic function is, or the main function is differentiation of sex characteristics. Other question I get asked is, okay, what is the difference between total and free testosterone on a blood test? So testosterone total is the measuring all of the testosterone that's circulating in the bloodstream, if it's a blood test. We can also do it using saliva. In saliva, it's typically just free testosterone. But the most common test is the blood work. So when you get your blood test done, total testosterone is all of the testosterone. Total testosterone is sort of, even if you have a high testosterone level or a high total testosterone level, that does not mean that you can't have symptoms of testosterone deficiency, because the free testosterone is the important type of testosterone. It's free. It's not bound to sex hormone binding globulin, so it's free to exert its action on the tissues. If you have a normal total testosterone, but you have a really low free testosterone, you're going to have symptoms of low testosterone. So always get checked a total testosterone and a free testosterone. Testosterone binds to a molecule called sex hormone binding globulin, which is produced by our liver. So the body keeps the testosterone in bound form, and when it's released from the sex hormone binding globulin, the testosterone is free. It can go to the tissues and exert its action. So free testosterone is a more important type of testosterone. What are some of the symptoms of low testosterone in men? So testosterone levels, they start declining around age 40. Now I'm seeing even my younger patients who are in their 30s, the testosterone levels are going down. I mean, of course, we live in a sort of a toxic environment, polluted environment. Our food is not the best. So testosterone levels start going down. So symptoms initially, you may not feel much because the levels are not abruptly declining. They're declining very, very slowly. So lack of motivation, you can have fatigue. It's hard to build or maintain muscle mass. Men tend to be more irritable. They can be more tearful. You're watching a movie that is not so sad, but you still feel like you want to have a tear kind of trickle down your cheeks, which are not typical characteristics or personality traits of men. So men are supposed to be, generally firm with their emotions. Men are generally distant when it comes to emotions. Common complaint women have, but that is a testosterone. It kind of makes us distant. It makes us less reactive to emotions. So when the testosterone levels are low, men tend to be more moody. They're more irritable. It's andropause, right? It's not fun to be around a male who's having all of those symptoms. In addition, the sex drive goes down. There is lack of motivation to have sex. There's lack of motivation to do anything. But men carry on. We generally will rely on stimulants like caffeine, Monster, Red Bull, coffee, alcohol, cigarettes, to kind of help improve some of these symptoms. But always get testosterone level checked when you have these type of symptoms, where you just feel like I'm 40, but I feel like I'm in my 50s. I don't want to do anything. I just want to sit home, watch TV. I don't feel like having sex. I don't sleep good. I'm moody, emotional, all of those things. Now, what are some of the symptoms of low testosterone in women? So a lot of the similar symptoms, So again, the sex drive goes down. Women can be a lot more emotional. They can be a lot more tearful. They are more irritable. They can gain a lot of weight. So those are, you feel like, also that you're getting aging quickly because, the muscle tone goes down. So we can have more slouchy sort of appearance. A lack of motivation is a big one. Lack of sex drive, or even if the sex drive is not so bad, it's difficult to climax if the testosterone levels are low. So those are definitely some of the symptoms that we experience. Now, the levels are declining slowly, so the symptoms also are declining slowly. So a lot of people don't associate it with low testosterone. They're saying, oh, I'm just getting old, that's why I'm feeling this way. And the symptoms are sort of such a slow decline that we sort of adapt to our new lifestyle. But a simple blood test can figure out, what's wrong. Okay, so that was the next thing. So, right, how to test for low testosterone. So a simple blood test doesn't cost much. We'll check your total testosterone, free testosterone. Always will also check for sex hormone binding globulin. In addition, I will check a thyroid level too, because there is a little overlap on some of these symptoms. So simple blood tests, always do it if you're over age of 40. Even if you're not feeling any symptoms, good idea to have a testosterone level check. They are generally going to be low. So now we talked about the symptoms. So what is a normal level of testosterone in men? It's a tough question to answer. If you go by the lab ranges, it varies, and it can be from anywhere from 300 to 1100. Now that is very difficult because, what if you are 400 and you're 40 years old? You're still in the normal range, but is it normal testosterone? So to me, it's not so much whether you're in the normal range or not. It is what is your age, what is expected testosterone to be, and what kind of symptoms you're experiencing, and what kind of lifestyle you have. So if you're someone who is 50 years old or 60 years old, and you have a healthy lifestyle, you exercise on a regular basis, you want to build your muscle mass, you want to maintain your muscle mass, naturally the testosterone levels will be a little bit higher, because exercise is a good stimulant for boosting testosterone levels. So men who exercise regularly do tend to have high levels of testosterone, especially exercising with big muscles like the leg muscles. So if you do a lot of leg workout, testosterone levels will be higher. So I always tell my patients, don't worry too much about whether you're in the reference range or not, because the range is 300 to 1100. If you're having these symptoms and your levels are even borderline low to normal, I would generally treat you with supplements to boost testosterone, or if they don't work, then of course testosterone therapy. So the reference lab ranges are not very helpful when it comes to treating somebody with testosterone. What are the levels for normal levels for testosterone for females? So common misconception is that women don't need much testosterone. It's true, women don't need that much of testosterone as men do, but women also need testosterone. So generally, we'll say about 40 to 60 would be a decent level for a female. Again, if the female is having a lot of symptoms, hey, I'm not motivated, my sex drive is bad, I'm gaining weight, I feel old, I look old, and we check the testosterone levels, they're kind of on the lower side, I'm having hot flashes, they need either testosterone boosters, generally that's the first approach to start, or they will need some sort of hormone balancing with testosterone. So don't rely too much on what is normal. What is normal may vary based on how old you are and what type of lifestyle you have and what type of lifestyle you want to maintain, okay? Next question generally is what's the best way to get testosterone? There are so many types of testosterone replacement therapies available these days. So the most common one is the testosterone injections. It's where we inject yourself in the muscle, or it can also be in the thigh, or it can also be given subcutaneously under the skin. So this is the most common type. It's also the most cheapest way of giving testosterone. Most men will start with the testosterone injections, but over time, people will generally migrate away from it because we have to give a very high dose of testosterone when we're giving testosterone injections, because the skeletal muscle has a decent amount of blood flow. So we have to give higher doses so the testosterone can stay there for the duration of that 1 week or 2 weeks, depending on the type of testosterone that is injected. There are also a lot of peaks and lows, or highs and lows when with testosterone injections. So if I give my injection today, I'll generally feel great for the next about 2 days, maybe third day, I'm going to start seeing a decline again. And then I'll be again, lack of motivation, all the symptoms come back. So we go through high lows with testosterone injection. And we also have to give a very high dose of testosterone. So there is a potential for more side effects. So it can raise your PSA level, which is a marker for prostate cancer. You can have more hair loss, acne, oily skin, all of those things can be problematic. So injections are cheaper, but not the best way of giving testosterone. And some people don't like the idea of injecting themselves. They don't want that pain. The second option would be to do testosterone tablets or testosterone capsules. So in the past, oral testosterone was not available. It was considered toxic because it has to go to the liver. So now there are newer versions of testosterone that can be taken orally. This is a capsule that you take twice a day. Most men have tried this on. They don't like it for a couple of reasons. One, you have to take it twice a day. The levels don't go high enough generally with oral testosterone. So they are feeling like, hey, I'm getting better, but I'm not where I want to be. There can also be some side effects like stomach issues. You can't take it, you have to take it with some sort of food. You can't take it on an empty stomach. You can have a lot of dry hands and skin problems with oral type of testosterone. So it's available, but not generally, most men would not like it, and I don't recommend it. Then, of course, is the testosterone creams and gels. They can be alcohol-based gel or non-alcohol-based. Again, an easy way of giving testosterone, you can inject yourself. Instead of injecting, you just take some gel out of a pump. You just rub it. Can be rubbed on the inner part of the thigh, around the belly. Very, very convenient. Again, similar issues. The creams and gels are sort of messy. Women are more used to applying creams on their face and this, so they're very comfortable with the idea of creams. Men, they don't like creams. They don't like gels. They feel like they're kind of messy. The other problem is, again, you will not get the same levels that you can get with injections. So you are feeling better, but not as better as you want to be. So those are the issues with the gels. The other part is that if you have young kids, or your partner, so your wife, so you could transfer the testosterone to them. And young children can cause puberty issues. And if it's your female partner, they can have issues with acne and trust me, it happens. So I had this female client who came to me with a lot of acne and facial hair. She don't know what's going on. And the first question I asked her is, your husband using testosterone? And he said, nope, he's not using testosterone. And it's can you find out from him? Can you call him? And so she did call him, and actually he was using testosterone cream. He was just not telling her, right? So always make sure your partner is aware, because the gels can easily spread. So make sure those clothes are washed and they're handled by, either wear gloves. So those are the problems with gel issues, right? A lot of risk of transference. And also, as we get older, our skin does not have the same amount of blood flow. So sometimes it's just gels, they sit on the skin and they don't get absorbed. That's a problem. The other option is doing testosterone pellets. They are FDA approved, and they're size of the rice grain. There's a video on my channel where you can see the actual procedure. It takes less than 10 minutes. So we insert this pellet in the subcutaneous under the fat layer, and it slowly dissolves. So the benefits of that is, generally we'll put a pellet every 4 or 5 months. We actually put it more than once. So there are a couple, depends on your level you have and the level we're trying to achieve. There can be a number of pellets that can be placed. Small outpatient procedure, less than 10 minutes. And then the pellets slowly dissolve. And then we just put new ones in every 4 or 5 months. So men love this method because it's kind of stick it in there and just forget it. The other beautiful part about testosterone pellets is that we have to give lower dose comparing to testosterone injections, about 80% less dose with testosterone pellets. So you have fewer side effects, less rise of PSA, less rise of hemoglobin, less hair loss. All of those benefits are there with testosterone pellets. What happens to the sperm count if I start testosterone? So when we start testosterone therapy, we are sort of sending a negative feedback to the brain that, hey, I already have enough testosterone, so my body does not need to make any. So testosterone injected or testosterone from outside will suppress 2 hormones from the brain called FSH and LH, or follicle stimulating hormone and luteinizing hormone, which are important for production of sperm and for maintaining of testicular volume. So men who are on testosterone therapy will have shrinkage of the testes. It becomes smaller, and the sperm count also goes down. Now, we can't prevent that from happening by giving HCG injections, or there's a medication called clomiphene citrate. But the best advice I give is to men that if you haven't completed your family, the best idea is always store your sperm, because the sperm count will go down and it can cause infertility. And I can tell you, I've taken care of a lot of patients who come from other clinics and they were never told about this, and now they want to get pregnant, but they don't have kids, but they are unable to. So always freeze your sperm if you have not completed your family. Okay, so those at least were the common questions, at least I remember, that I commonly get asked. This is Dr. Raj Singh. I hope you liked this video. If you did, please do not forget to like and subscribe. And if there's a video you'd like me to make or you need some clarification, please leave a comment below. Thank you so much.